Nasopharyngeal and oropharyngeal swabbing for COVID-19 and MERS-CoV. For laboratory diagnosis of COVID-19 and MERS-CoV, lower respiratory tract sample is preferred. But in situations where collection of deep sample is not achievable, nasopharyngeal and oropharyngeal swabbing is advised. It is essential to follow proper infection control measures when samples are collected from patients suspected of COVID-19 or MERS-CoV. The staff should wear fit-tested respirator mask, gown, protective goggles or face shield, and gloves. Nasopharyngeal and oropharyngeal swabbing is considered as an aerosol-generating procedure. That's why an airborne infection isolation room or a negative pressure room is required. A trained healthcare practitioner must prepare the following materials before doing the procedure: a viral transport media, PPEs such as fluid-resistant gown, fit-tested respirator mask, gloves, protective goggles or face shield, a tongue depressor, and a biohazard bag. The process of collecting the nasopharyngeal sample will be demonstrated using a sagittal sample of a human head. Slowly insert the viral transport media swab until you feel a slight resistance at the end, which indicates reach of the nasopharynx. Remember to perform hand hygiene and properly don your PPEs. Begin with carefully explaining the procedure to the patient. The patient should be alert and cooperative. Allow them to first blow their nose. The patient should sit and relax in a comfortable position during the sample collection process. First, slightly tilt back the patient's head so that the nasal passages become more accessible. Gently insert the swab into the nostril. Keep the swab near the septum floor of the nose, while gently pushing the swab into the post-nasal pharynx. As a visual reference, the swab should be inserted at about half the distance from the opening of the patient's nostril and the ear. Rotate the swab several times. Gently remove the swab and place in the viral transport media. After collecting sample from the nasopharynx, prepare to collect oropharyngeal sample next. Oropharynx is located directly behind the mouth. Sample is obtained by directly inserting the swab into the posterior pharynx. Rub swab over both tonsillar pillars and posterior oropharynx and avoid touching the tongue, teeth, and gums. Again, inform the patient that the test will feel uncomfortable for a short time and may trigger a gag reflex. Depress the patient's tongue using a tongue depressor. Gently insert the swab into the oral cavity without touching the lips, teeth, tongue, and gums. These surfaces should be avoided as they are colonized with a wide range of microbes. Collect the sample from the back wall of the throat. Twist the swab shaft gently but thoroughly, sampling the oropharyngeal wall and tonsillar pillar. Make sure that the viral transport media is tightly sealed and properly labeled before carefully placing inside a biohazard bag. Remove your PPEs without contaminating yourself and the surface and perform hand hygiene.